Hi, I'm your host, Dr. Phil Hoffman, and welcome to Pause. Today we're going to be talking about an upcoming event for Johnson County Hospice that's coming up next here on Pause. And thank you so much for joining us here on Pause. We have a full studio today, so I'm going to refer to my cheat sheet notes here. We're joined by Peggy, Shaul, Norma Busby, and Theresa from Johnson County Hospice to talk about events and the hospice itself. Welcome.
Welcome. Thank you.
Well, let's start, Theresa. I know you're director of the hospice, so let's talk a little bit about what hospice is and what kind of services you provide for folks.
Hospice is when your physician feels that you have 6 months or less to live. They've diagnosed you with a terminal diagnosis. Most people automatically think of cancer, but it can be like heart failure, end-stage diabetes, ALS, anything like that. It doesn't just have to be cancer. But the physician is stating, unfortunately, that they feel if the disease takes its normal progression without any interference, meaning chemotherapy, radiation, anything like that, that they think you have 6 months or less to live. Now, we always caution our clients that 6 months is a number. That's all it means. None of us can tell you when you're going to leave this earth. Not any doctor, not any nurse. So it's your best judgment.
And always a difficult thing, I mean, because you're dealing with folks who are in that end stage of life, at least theoretically, they're in that end stage of life. So it's a difficult environment to work in, I would think, every day.
It can be, but it can also be very rewarding. That's why I personally went into hospice. I tell my clients that this is the one and only time that you get to call the shots. You get to tell the doctors, yes, I want to do this. No, I don't. And they won't try and persuade you to go any other way. So you're calling all the shots. You are living your end of life the way you see fit and how you want to stay comfortable, and we'll help you with that. We do a lot of education with the families, helping them prepare for their loved ones' end of life, to educate them as to what might be coming as their disease process continues on. But then we also help with spiritual. It's a holistic approach. So it helps a lot.
And Norma Jean, one of the things that I know that Johnson County Hospice relies on a lot is volunteers, and you're working with some of the volunteers. Where are people able to come in and help in hospice?
In any part of the facet of helping the caregivers, helping shopping, helping just be in the family environment, to give the family a break, to kind of ease everybody's mind, to know that they're supporting at least 5% of the care of the hospice, but they're providing companionship. They're giving breaks to the caregivers is the main thing. From running shopping to just being there, just to maybe let someone get a break for about an hour, or run shopping errands, or
it might be that their loved one just wants to go walk around in their flower garden, or go out and tend to the garden, or go out and mow the lawn. So they just want somebody that might be sitting with their loved one. But then we have also had volunteers, in my experience in the past, we've had a youth group come to the patient's home for the winter and help winterize it. So clean out the gutters, take a look and put the covers over the air conditioning units, anything like that. Or it might be that they line up and they'll be the ones that'll come out and shovel the walkways whenever it snows. So basically it's whatever the family needs. We just can't do direct patient care.
And Norma Jean, what if folks are interested in volunteering, how do they go about doing that?
They can go to our website, or they can contact me personally. There's a lot of information out there on our web that gives them some ideas and information. But mainly just come in, kind of look at everything, and let us talk.
And they do require training.
Yeah,
I mean, they have to go through a series of training to be prepared for that volunteer job, if you will. So.
And this is Peggy, by the way. So Peggy, let's talk about now, one of the things we wanted to talk about today is an upcoming event as a fundraiser for Johnson County Hospice. So we have a homes tour that's
We
coming up
do.
in November. Can you
Yes.
explain what that's about?
I can. We've done a variety of fundraisers over the years, but we wanted something a little bit bigger that would just promote our hospice program and just get the awareness out there of what hospice is and maybe open it up and start that conversation. What is hospice? So yes, the event is the Holiday Homes Tour. It's Friday, November 20th of an evening from 5:30 to 9 p.m. And then all day on Saturday from 9 to 3, we'll have 5 homes in the Warrensburg area and just right outside the Warrensburg area that are open to the general public with the purchase of a ticket, of course. And 4 of those homes will be decorated for the Christmas holiday, and 1 will be decorated for fall. And we have quite the mix of homes. It's exciting. We've got great homeowners that are very energetic and very gracious to let us utilize their homes for the homes tour. We've got a traditional estate. We have country manor. We have a classic Victorian. We have lakeside living, and then we have the Good House. Many people might be very familiar with the Good House, as it used to be a bed and breakfast. So very excited about showcasing those homes and utilizing this opportunity to open that door to talk about hospice. So each home will be dedicated or in the memory of a loved one to kind of tie it back to the hospice theme. They don't necessarily have had to been on hospice, but obviously someone that's passed away that meant something very special to that family. And so in each home we will have a mini tree of lights, which is also a fundraiser that we do each year. And we'll have a mini tree of lights, and by that mini tree of lights we'll have the photo of the loved one that the tour is in memory of. Also, in conjunction with the Holiday Homes Tour, we're having a holiday boutique, and that will be at the back of the Good House in the sunroom back there. And so we'll have a lot of local artisans and craftsmen providing holiday gifts and unique opportunities to start your Christmas shopping. And all of that will be donated so that we can use those funds. All proceeds for this whole Holiday Homes Tour will benefit the patients and the families on our Johnson County Hospice. So we're excited about that. And tickets they'll be on sale for $25 a ticket, advance purchase, and then $30 the day of the tour. You can still, if you don't know for sure what you're doing, but you want something fun to do for that weekend, you can purchase it at the door. You can go online and purchase those tickets on our website. And we have several vendors throughout Warrensburg, Knob, Holden, and Kingsville where you can also purchase those tickets as well. So that's exciting.
And it's November 19th and 20th, right?
November 20th and 21st.
Okay.
20th and 21st,
Right.
Yep.
So November 20th and 21st, and if you buy a ticket, can you go either day, or is it specifics? Or?
Yes, actually you can, the ticket gets you entry into the home once, and you can do it a combination of Friday evening if you want to see all the homes should be lit up as well. So you can do it combination of Friday night and Saturday. You can squeeze it all in Friday night, or you can do it on Saturday. It's your choice. But each home you get one entrance into the home.
And as a fundraiser, let's talk a little bit about that. The Johnson County Hospice, I think sometimes people are sort of under the impression, well, this is a county thing and they pay all the bills and that's Johnson County Hospice. So explain why you need to raise funds.
Good question. We don't always have the ability to cover the cost for a patient that goes on our hospice services. We do accept Medicare, Medicaid, private insurance, but a lot of times hospice has to cover a lot. When we take on a hospice patient, we absorb all of their cost. The cost of the care, the cost of all of their medications, and their durable medical equipment. So that hospital bed, the walker, the bed, all of that. Thank you. Yep. Thank you. All of that goes in. We absorb that as the hospice. You take on all of those costs. When a patient comes on service, and maybe they're only on our service for a week, Medicare pays a finite amount per day, and there's no way that that cost covers the cost of the care that we provide in that week, or even in months of service. So what this does is allow to fund the program a little bit more to cover our cost. Plus, what we'd also really like to do is in the future, we would love to have a program or a fundraiser that would fund a specific fund. You know, you've heard of Make-A-Wish Foundation. We would love to be able to do special things for the hospice families, and more specifically for the patient, whether it's their last wish or what have you. But that's really what we're going for. But right now, just to kind of cover that gap in the cost, that's our goal. But our ultimate goal, because this is our first annual, we plan to continue this for many years to come, is to build that fund up and actually do some special things for the patients.
And we were joking earlier, but there's a little bit of truth to it, I think, that if you're just a generally nosy person, as am I, this is a great way you drive by somebody's house and you think, wow, I wonder what that house is like on the inside. This is a great way for folks to legitimately do that.
It is, and you can purchase a ticket, but we also need lots of volunteers. So each home, we're going to have 10 to 15 folks in the home for 3 different shifts. So we need lots of volunteers to help us. We want people in there to share information about the home, as well as just keep people from being nosy and opening doors that they shouldn't. And just kind of keep the flow going, but more importantly, just to give the homeowners who probably won't be there during the tour the satisfaction that their home is being safeguarded, and that we're sharing information about the home that you wouldn't normally know just by walking through it and looking with your just looking to see stuff. It's interesting to know what that is on the wall and why it's important to the homeowner. So that's exciting. So lots of volunteers are definitely needed, and you can definitely call our office or go to the website and get more information about that as well. We do have a web page dedicated specifically to our holiday homes tours. So we've got the photos of the homes showcased on there, and so you can check us out and find out more information.
So now I'd like to do just ask each of you a question, I guess, individually. What drew you to hospice? What made you decide that you wanted to work at a hospice? So since you're the boss,
Okay,
I think
get
it
to
seems
start?
logical for you to start, right?
Okay. What drew me to hospice was a film that Tom Hanks starred in, Philadelphia. It hints to hospice in the background, and I just fell in love with it. It's the way to keep the patient comfortable their last days on this earth, and that's very important to me.
And when you have folks that are volunteering there, this is probably more of a Norma Jean question, but you don't need to be a doctor. You don't need to be an expert.
No. We have volunteers that range from high school students that are available after hours and on the weekends, up to, I believe, our oldest volunteer is in her early 90s that still helps and drives to and volunteers and does whatever we need her help with.
Wow, that's awesome. I hope I can do that when I'm 90. So how about you, Norma Jean? What drew you to hospice?
I really, since my mother died, it was not knowing at that time about hospice and getting the knowledge out there. If I'd have had more knowledge about the process, I think I would have made different decisions with my mother. So I want to be there for other family members that may be getting ready to go through the same thing and maybe are scared to ask a question, or maybe it's just the not knowing. And I just think the knowledge that we need to get out to the community, I just want to help out. I just want to make sure that they have everything they need at that time of life.
Okay. Peggy, how about you? What drew you?
Well, interesting. I'm the financial director there, so I knew nothing about hospice whenever I started to work for Johnson County Community Health, and had to learn a lot of the different facets. Really didn't have a whole lot of medical background to start with. And so I have a deep admiration for the nurses and the caregivers, always have had. And so the more I learned about hospice and the more I heard the stories from our nurses tell, and the compassion and just what they can do for those families and the patients to make that end of life a smooth transition, it brings you to tears many, many times. And so I didn't go into it knowing that, but I walk away with it, and I just want to bring that awareness and get the word out, because so many people really are scared of the word hospice or don't have a true understanding of what it means to be on hospice. They just think that it's, you know, a death sentence, and that's not true. We can do so much, and the sooner that we have them in our care, the more we can provide a more comfortable end of life passing for them. So, plus we also provide bereavement services for the family up to a year after. So we're also there as a support team to help the family through the grieving process and give them all kinds of different support, or lead them to the areas where they can get further support. So.
Well, thank you. And then just a reminder, if you're watching us right now, the Homes Tour is coming up the 20th and the 21st of November.
Correct.
So if you would like to take a tour and help out Johnson County Hospice, we encourage you to do that. And of course, also you can be a little nosy. So I'm just saying, it's a good way to win-win, right? And of course, you can visit the Johnson County Hospice online at their website, or you can go to our website, kmos.org. We'll make sure we get you connected to them so that you can get the tickets and volunteer if you're interested. So give us a call here at KMOS. We'll help you with that as well. And that's it for this segment. We'll be back with more coming up next here on Pause. And welcome back to Pause. And now joining us, we have Tara Walker and Jake Rogers from Boys and Girls Club. Hello, welcome.
Hello, thank you.
So let's talk a little bit about Boys and Girls Club. And you are from Cole Camp, the
That's
Cole
correct.
Camp area. But let's talk about the club itself and what the mission and purpose is of Boys and Girls Club.
The Boys and Girls Club of West Central Missouri, we have 11 sites. We have 6 in the Sedalia schools, and we have 5 in the outlying rural areas. Leeton, Lamont, Smithton, Green Ridge, and Cole Camp.
It's a test, right?
Yes,
See if you remembered all
I
the
always
locations.
forget one.
So what kind of services do you provide?
We provide after-school care. We have the kids come after school. We provide a healthy snack. We do power hour, which is homework help, and then we go outside for recess, and we provide programming. We are in the sites till 6:30. The teen sites are until 7 o'clock.
And so, Jake, I know you are a staff member, junior staff member in Cole Camp. And so we're in the program, and now you're working with the program. Tell us a little bit about what your role is there.
My role is when I get there right after school. We go into the cafeteria and we eat snack, and then we go to power hour. And I always go to the 3rd grade power hour. I help with homework, reading, whatever needs to be done. Then after that, we go to recess, and I go outside and help the YDPs watch and make sure everybody's okay. And then I go to, we do programs. So I help the YDPs with whatever they need in the program. So if there's anything that needs to be done that they can't do because there's kids, I will do it. As in if they need supplies or whatever they need.
So Jake, now, and I don't know, I apologize, YEP?
YDP.
YDP. What is that?
Youth Development Professional.
There you go. So I'm asking on behalf of my viewers.
Yes.
I of course knew. So the program itself has been around for many, many years, right?
Yes,
Boys and Girls Club?
Yes, it has been. It started, back in the early 1900s with the Boys Club. And then in the 1990s, it became the Boys and Girls Club.
And I know you often see there was a very successful ad campaign not that long ago with a lot of Hollywood actors and so forth who talked about their experiences in Boys and Girls Club. When you see youngsters coming through the program now, what kind of things do you see are the biggest needs? What do they really need the most help with?
I think in our perspective, in our community, they definitely need the homework help. We provide a safe place for them to go home. Many parents are working. It gives the parents, peace of mind that they know they're with somewhere safe. They also know they're getting that healthy snack, and most importantly, that we're helping with homework. So when they do go home, they have quality time to spend and not fighting over getting homework done. That's, to me, I think is our main goal and our main purpose.
So Jake, you said you help with 3rd grade homework, right?
Right.
Can you handle that?
I can.
Okay, just making sure. So typically when you're working with the kids and they're having difficulty, what kind of problems are they running into? What's the hardest thing for a 3rd grader today?
Hardest thing, spelling.
Is that right?
Yes. They do not know how to spell very many words.
But you're working on that with them, right?
Right.
So as you work through the program, have you done it for more than 1 year?
I've done it for 3 years. This will be my 3rd year.
So have you noticed any changes? Or kids getting smarter, dumber? What, what's happening?
The first year I was there, they did better. And then as it went on, I feel like they're learning less, but at the same time, they're learning things that they haven't learned before. So maybe I'm learning less. I don't know.
And I'm not sure where they are in the math section of things. Are they doing the weird math? I know some of the things that they do now.
Not yet.
Okay, a little bit different. Right. So that's good. That's why you picked 3rd grade?
Yeah.
Okay. So if you look at the program itself, I think one of the things that's interesting to me about it is the way you're housed. Can you sort of explain to viewers how that works?
In major cities, the Boys and Girls Club are in standalone buildings. We are in the schools, so we are the guest of the schools. We pick them up, they come right to us after school. We go right to the cafeteria, we use their classrooms, their gymnasiums. So we have a very good, strong relationship with our schools. New this year, our teen program in Sedalia, they do have a standalone building, and it's working really well for them. And it's something that we strive for, that we all want one, but funds the way they are, we are perfectly happy in the schools.
Well, and it's a good partnership because it helps the schools make sure that kids are getting help, like with Jake, for example, with their homework. So if busy parents have to work and don't have any options for the home care, rather than having a kid left to their own devices, they can get Jake's help on their math.
That's right. A lot of kids have practices right after school, or maybe 5 o'clock, so they come to the Boys and Girls Club. They can walk to their practices. It's right there in the same facility. So it's definitely a benefit for the parents.
When we look at the services that are provided, like every organization, I'm sure there are places where you could use help. What kind of things do you need the most help with in the Boys and Girls Club, and how can viewers get involved?
Well, we are depending on grants. We have Century 21 grant. It's a 5-year grant, so every year of the grant we get less funding. We have several community fundraisers. Our biggest one is our auction in February. We have 2 golf tournaments. We have a glow run. We're always soliciting funds. So if you want to be a sponsor, there's just 1,000 ways you can do that. We have our own website. You can read about it on there, and if you'd like to donate, we would just love to have any kind of help, even if it's not financial. We would love volunteers or anything at all.
So Jake, we're going to talk about volunteers. Why do you do this? What made you interested in being a person at Boys and Girls Club?
Well, my mom started, so I started coming to help her, and I realized I want to be a teacher when I grow up and get out of school and go to college.
So even after doing it now for multiple years, do you still feel like you want to be a teacher?
Yes.
Well, that's good. It's a good work experience for you to really know something that maybe if you had just gone to college, you might have waited until you did your student teaching to really know what it was like. So that's a good opportunity for you. So what area do you think you're going to specialize in? Do you have any idea?
Science.
Science? And how are the students doing with science under your tutelage?
I haven't had much. They haven't had homework with very much science yet. I'm kind of sad.
Well, it's early in the year. Maybe it'll get more science intensive as you go along.
So.
Okay, so Tara, if you have folks who are watching the program right now and they want to find out more, whether it's to get involved or donate or to have their children attend Boys and Girls Club, how can they go about getting more information?
Well, we're on Facebook. We also have a website. You're putting me on the spot here. It's bgckids.com. And they can go on there and learn all about us. It has all our sites, our staff, our mission, and anything they would like to know about the Boys and Girls Club.
And Jake, for folks that are interested in volunteering, any words of wisdom or experiences you'd share with somebody who's thinking about being a volunteer?
Be prepared, because they like to challenge you. I'll just say that.
Third graders?
Yeah.
You're bigger than them, Jake.
Yeah, but they
Yeah.
think they're right.
Well, fortunately, you're not like that, I'm sure, right?
Right.
Well, Tara, we want to thank you so much for coming in and joining us today. And if you are interested in the Boys and Girls Club, we certainly hope that you'll visit the website or go to Facebook. And if you missed all that, you can always go to our website, kmos.org. We'll be happy to get you connected with the folks at Boys and Girls Club. Thank you so much for
Thank you
joining us
very
today.
much.
Thank you, Jake. I'm sorry that you had to miss out on part of your school day to do this, but we certainly appreciate you coming here. And that's it for this episode of Pause. I'm your host, Dr. Phil Hoffman, and we certainly hope you'll tune in again next time for more right here on KMOS. Coming up later this evening, you'll see more of our Your Thursday lineup, more local programming about your Missouri. That's right here on Your Thursday. Thank you so much for joining us here on Pause.